Good afternoon. Myself, Dr. Suvarna Magar. I am a practicing pediatrician at MGM Medical College, Aurangabad, and I am running a pediatric genetic clinic. So the challenges are a lot in India. I would like to start from the medical fraternity. So with the population of 120 billion in the country, we have just 40 medical geneticists, and there are very few, less than 100 clinical geneticists. And there are, for a population of such a big, the number of skilled doctors treating and diagnosing genetic diseases is very, very less. So we are falling short of manpower at that level. Secondly, with this variety of and huge number of population in India, we have very high level of endogamy, that is marriages between the community and not outside the community, has led to the bottleneck phenomena where the incidence of very rare genetic mutations coming up as autosomal recessive diseases is very high in the India and the South Asian countries. So we are, as a primary physician, are the ones, we have all the brunt, especially the pediatricians, gynecologists, radiologists. These are the people who will identify the structural defects and the genetic diseases. So it is, the time has come. Genetic diseases are not rare. If included cancer as somatic mutation, the incidence or prevalence of genetic diseases is 1 in 80. It is so high. So we just cannot neglect them, and we should empower the students from the MBBS level, the pediatricians, gynecologists, and all other who are looking after the phenotypic features of the genetic diseases. Another thing is on the patient side, the tests which are available for genetic testing, that is the DNA based test, though they are at a lesser cost, but now also the cost for these investigations is much higher as compared to the other tests which patient can undergo, and the financial conditions of the most of the patients is not as such that they will afford. Maybe in coming time, the cost of the treatment with this next generation sequencing technologies will come down, and we'll have more affordable investigations available for genetic diseases. So these are various challenges, and my first priority will be solve the challenge of increasing the manpower which will diagnose these conditions. Definitely there is a role of family planning in the prevention of genetic diseases. As we know that most of the genetic diseases, especially which present in the infancy, even in the antenatal period, where we can identify the birth defects, the neurological conditions where there is intellectual disability. So majority of the conditions where treatment is not available, the family suffers a lot on the social, financial, and all other aspects where everybody wants a normal child, intelligent child. So where these genetic diseases are there, which most of them do not have treatment, family planning with the identification of the genetic mutation if the child is affected and preventing the birth defects is primary prevention for the genetic diseases, which is very important step as far as our country is concerned, which we are a resource poor country, or we have very less sharing on this rehabilitation of these patients with disability, intellectual or physical disability. So definitely we have a role for family planning where we can prevent this disability, morbidity, mortality, and all this. Yeah, there are few conditions which are treatable. So inborn errors of metabolism, when we identify, so some of them are fatty acid oxidation defect, glycogen storage disease. The treatment is very simple if we identify them on right time. Even a few of the amino acidopathies, organic acidemias, there are diets available. So maybe a few years back we did not have that easily available, but now we have treatments very easily available. Some of them have only dietary modifications, so we just need to identify them. We have come up with renal transplant, liver transplant, heart transplant for all these genetic diseases, and we are successfully doing that. So definitely there are treatable conditions need treatment, that if it is available, we should do all the efforts to identify these conditions. Definitely we should go to the molecular level to find out the exact disease, and if it is treatable, it needs treatment, and that is what we are for as a physician. So to conclude, genetic diseases are not rare. We should have an open mind, positive approach towards identification of the genetic diseases, do the right test to identify the genetic diseases, reach to the possible molecular level to identify the exact diagnosis. If it is treatable, we'll definitely treat that, and let us all support to the rare disease patients. And I would like to say that alone I am rare, but together we are strong, and let's make a strong medical community which support this. Thank you.